Welcome to the Central Safety Group October meeting. We've got a wonderful representation online today for the talk by Dr Natasha Lazareski. Before we start, though, I just want to proudly announce that the Central Safety Group is now an incorporated association in the state of Victoria, and the rules of this association are on the Central Safety Group website, so you might like to jump on and have a read of those. It doesn't change much as far as how we operate, but certainly it does increase, I think, the professionalism of our organisation. As part of our planning for 2022, you will be seeing a survey. We'll go out next week asking you to help shape our program for 2022. While you're on our website, also have a look at the posts. Heather Turner has put up some information on WorkSafe seminars on the new dangerous goods regulations and welding fumes. And there's also some information where Monash University are doing a research study into night shift workers, and there's a call for organisations to participate. So if you have shift workers, I would encourage you to have a look at that link to the Monash University page. So here we're going to get into the real detail for Natasha Lazareski. She's going to be talking about returning to work in COVID times and particularly managing the psychological risks associated with this. Just by way of background, Natasha is a medical doctor, and she's also the CEO of PsyFlex. She has more than 20 years of experience as a medical director and wellbeing manager, building high performance and healthy workplaces. So I think we all aspire to that goal. So we hope that we will learn some very useful tips as we readjust to our workplace settings after 18 long months of COVID lockdowns and other changes. I think Natasha will also be discussing the impact of the confusing and misleading information, which I think is very important for us to challenge and champion in our own workplaces. So I'll hand over to you, Natasha, and I'll give you some hand signals around the timing for the presentation if we look like we're running tight to time. Thank you.
Thank you, Nan. Thank you so much. I actually just deleted a few slides because I didn't realize we're going to not go into the presentation straight away, so I hope we'll be all right. I'll just share slides so that we can begin. Thank you for inviting me to present today. I'm going to really talk and focus on a few points in my presentation. There is lots of information on the WorkSafe Victoria website that I'm going to provide a link to. So I just think that in order to get the best of my time here today, I'm just going to focus on specifics that you probably just a little bit underground and actually not underground, underneath, and digging a little bit deeper than what you have information available on the WorkSafe website. So can you actually see the slides well, or is it presenting well? Just not.
It's presenting beautifully, okay. Thank you.
Oh, great. Okay. So what we observed so far with pandemic and now COVID-19 is a huge increase in anxiety, depression, and suicidality. In Australia, but also globally. And most of it's coming from, obviously, the unknown factor. It's something new. It rapidly developed, financial loss, juggling so many different priorities. And also there is this loss of self-image and context of the pandemic. People started really becoming disassociated from work and trying to figure out where their place is at the moment. So the impact on psychological well-being the pandemic had so far is absolutely huge. And I think we're going to see we are going to still see more and more of it coming. the work arrangements are still changing. We're still trying to figure out what to do when we are now back at work and someone tests positive, and what does it mean for us, and how do we organize a workplace for whether we wash everything and send everyone home, do they come back, do they isolate, and so on. So the mixed messages coming from governments as to what should be done, what is the best practice from medical association also didn't help. So people found it, and which we're going to talk about later, is people really found it very confusing, didn't know who to trust and where to look for information. And I certainly remember at the beginning of the pandemic when I received so many frenetic phone calls from employers saying, what do we do? The bank was asking, do we wash all the money? We heard Chinese are washing money. Do we wash money? And they didn't have enough information from the leading medical experts at that time. We are actually in a process where we really need to look at what do we do in workplaces. Now, I'll just remind you, I'm sure all of you know this, and the risk management process for the psychosocial risks, we're applying the same principles: identifying hazard, assessing the associated risks, and controlling risk, implementing controls, and then reviewing those controls. So the psychosocial risks management is absolutely the same, the process. And what we're looking at is just a different as to what actually we're looking and how we are actually, what information are we obtaining and how we're assessing that. The impact of pandemic on human being, what we need to also be aware of is not only psychological. What we've observed so far, there are psychological responses like low mood, low motivation, exhaustion, anxiety, depression, but also it represents through physical reactions like digestive problems, dermatological reactions, rashes, and so on. Lots of cardiovascular disease, considering that the stress hormone, the cortisol, is quite increased. And whenever we have situations like this, which is a constant stressors, we see increase in cardiovascular disease, also musculoskeletal disorders like unexplained aches and pains. What we've noticed in sense of injuries at workplace, we also found out that there are more injuries and accidents due to the reduced activity and also a lack of focus. We found out globally that lots of trips and slips are happening, and people are just not focusing quite well on their task at hand. We also noticed increased absenteeism and presenteeism, and we know that obviously situations like this will impact the morale and engagement. So it doesn't paint a good picture, does it? Unfortunately. What we need to do is basically, when we're looking at how we're going to manage the psychosocial aspect of it, is every time you're looking at any physical hazard, I would recommend, whether it is COVID at this point of time, but anything else that will happen in the future, you should always look at how is this going to impact the human mind and the perception of what's going on at the workplace. and how is it going to impact our psychological health and well-being. New measures that you're implementing as well, or HNS measures that controls that you're implementing in place, like wearing masks, gloves, can also become a risk for the psychosocial well-being. So you need to be aware of that as well and assess that in a sense of how is this going to impact. So what we've seen during this pandemic is also wearing masks, prolonged wearing of PPE, and using different type of equipment, having to sanitize hands before and after. All of that also had an impact on psychological well-being. So we need to really make sure that we assess any measures that we're implementing, not just for COVID, but any for psychosocial well-being aspect. At this point of time, I would also recommend that in a case you have people staying at home, working from home, and I'm sure that's going to continue because we're finding lots of positive feedback on people, work-life balance improved in some cases for people working from home. So it seems that lots of businesses are going to start keeping, that 2 or 3 days working from home practices. Or what we're going to see as well is that lots of people are going to have to isolate for 2 or 3 days and work from home when they have COVID-like symptoms, because we will want them to stay at home. It is important that you actually assess that part of work for psychosocial hazards as well. So understand what's happening at home and, what is the impact on personal psychological well-being. Just a reminder, it needs to be a consultative process, which means that you need to gather information from your workforce. This is not sit in one room exercise. As much information as you may have about your business, it is important that you actually, work with the workforce, obtain all the feedback forms. I would recommend strongly that you, complete at least the psychosocial culture survey about the leadership support in psychological health and well-being, but also any feedbacks or any forms that you can ask people to complete, have feedback sessions. You need to obtain that individual perception of the culture and what's happening in the workplace, and consult with unions, obviously, and with other groups. And because what we are looking at when we're looking at the psychosocial risks, it's not what we believe that risk may be going through this list of 10. There are actually 11, but I listed here 10 that I think are most important at what time. It is what people perceive, the importance of the individual perceptions of what the workplace is like for them. Is actually what you are assessing, and then the measures you are implementing is measures that are going to actually help those individuals, not just those individuals, but the whole workforce live better life at your workplace. So I've just listed here 10 areas that I think are very important for action in psychosocial risk I'll just show you here. There is actually a really good website that WorkSafe Victoria created. I'm not sure if you guys are aware of it. It is actually providing you with the detailed information about risk management and approach for work-related stress. I do strongly recommend, if you haven't been there, to go there and read through it. You will see a list of psychosocial risks, and it will actually help you look through it and understand what you need to look at. What I want to also highlight, it is absenteeism management that I would probably add to this. It's interlinked into work-life balance and management leadership and communication, training, social support and psychological support. But I did pull that out just so that I highlight it in this point of time in COVID times. It's really important that you have a very clear guideline for the leaders and for people. What happens? How is that managed when you have someone coming to work with potential, with just a sneeze or a cough? We do have, and we'll talk about it, but people that may already come in with a high anxiety, people that have immunodeficiencies issues, or are there on immunosuppressants, or they have some diseases that they can't get vaccine or something like that. It is very important that you're absolutely aware of it. You do actually work with those individuals, and you also have a clear guideline of what happens when someone is, when someone comes in with symptoms, and what is the support you're offering. Again, I'll just remind you of what I said before, and I'll highlight it again. Consider individual characteristics of workers when assessing the risk associated with hazards. In this point of time, it is very important that you are aware of any psychological issues and people with pre-existing psychological issues. We had so many clients that suffer from OCD or from anxiety or previous anxiety or from some really significant health issues that are actually at the moment finding this situation quite complex. And also we'll talk about it later. Family violence is always on our mind. Family situation is very important, understanding what is going for a person and providing support there. We are dealing, when we are assessing psychosocial risk, and we're trying to understand what is it that impacts our employees. I cannot stress strongly enough that we are actually talking about human brain and the way we actually function, and it's quite normal for every person to have a different perception of what's going around based on the way developed, based on their background and everything else. And we should actually normalize that and educate our staff that is expected. So, we've noticed that with all of this everywhere around the world, with people, against and pro-vax and against and pro-masks and things like that, people are having a really different reaction to these. Base of all of that is actually a human mind that we really need to take in account when we're doing this. This is not a clear-cut assessment of, a desk that you brought in, a new machine, or let's talk about silica. This is something more complex. This is really looking at the gist of a human being, which is a human mind. And the main question the human mind is asking is, am I in danger? And the main answer we're looking for it is, am I going to be safe? Am I going to be protected here? So regardless of the behavior you're seeing, whether it is positive behavior of someone wearing mask, looking at wearing gloves and vaccinating, or someone who is not wearing mask, not wearing gloves, not getting vaccinated, the brain is basically doing the same thing, and that is trying to desperately find a way to protect this body in a different way. So that's basically what's happening. And the next question the brain is going to ask in any challenging situation, is, do I belong here? Am I around enemy or a friend? And the brain really looks at the behavior, looks at whether I can trust people, whether I can trust what you're saying, whether you're consistent in your messaging, whether you actually delivered with what you said before, so that I can actually trust that you will do it again. So when you are when you're assessing the risk, and when you're setting up your strategy, you really need to be fully aware of what is your communication, what is the previous experience with the workforce. Every workforce is different. I worked with Ambulance Victoria, and I worked with National Australia Bank. It was completely different workforce, was completely different previous experience they went through. And my approach in setting up the psychosocial controls was completely different. The engagement was different. So you really need to understand the social interaction and the background of your workforce so that you can actually appropriately communicate. If the behaviors of people and the management previously neglected psychological well-being, if they neglected health and well-being of the individual, if that behavior didn't model the health and well-being, then you will have a workforce that is distrusting, and whatever you say, you need to be able to really find many channels in a way of communicating to them. So that's okay. I think I'm going to come back to that again. And so in most situations where we are finding ourselves in challenging environment. Sorry? Someone's mic is on. I thought someone is saying, can you hear me? So in most situations when we are finding ourselves in challenging environment and we don't know the outcome, we are in unknown, our brain just kicks in this reactive mode, which is, the low road thinking, we call it. It's just your amygdala and reactive brain. And what we ask here is this good or bad for me? Do I like this? Do I trust you? And so that's what we're seeing, when you see people out there questioning vaccine, questioning medication, trying to find solutions on Google that are not, something that the doctors have been recommending. It's basically this brain trying desperately to work out, something else and find the safe solution out. And so we end up in this reactive thinking, which is all about me, am I safe? It's either black or white, it's either good or bad, it's either right or wrong. And that's something that you will have to fight. It's a metaphor, not literally fight, but something that you will need to be aware of, and you need to really work with really hard. And that is that you need to work on really unhooking, and opening up and opening eyes to people so that they're not really closed, like having those dark glasses on and thinking with their reactive brain, but actually jumping out and being able to observe the situation more clearly. And so you need to work on in your strategy when you start implementing your psychosocial controls. The most important control you're going to implement is that engagement strategy, that communication strategy and training that is going to actually engage these people, call them in to open up and think about others. So, instead of being in this space where I'm lack of awareness about my behavior and what I'm doing and how that impacts others, to actually go into that thinking brain about what others think and feel, what am I thinking and feeling and doing, and how can we together work through this. So moving on from being focused on me, myself, and individualistic to actually us, and as a work environment, as a group that need to go through this together. So what we basically call that is psychologically flexible response. So we have a psychological flexibility ability to open up, be in the present, and actually, allow that feeling of immediate threat to be there without responding straight away. And so I will just quickly go through the list. I'm going to share these slides. You're going to have them. And I put lots of information on it so that you can actually use it later on. I'm not going to talk through all of it, but I'm going to mention the most important parts that I think you need to kind of take away from this session. So the first hazard we're looking at is environment and equipment. In addition to human brain that I just discussed. So when we're looking at environment and equipment, we're really, it's not different to, usually how you would do it. You're looking at the layout and equipment that people are using in the office. In COVID times, as I said before, there is difference between, people. It depends on which mindset they have. Some of them are really quite relaxed about getting infected at work and, exposure to virus, and some of them are really quite anxious. And so, that's one of the areas that you need to look at, understanding how you setting up your work environment from the virus COVID-19 perspective, and how can that impact the psychological health and well-being and perception. So you need to really understand that impact and communicate it correctly. You need to be really aware of the misinformation that may be around why should I, why I had the questions over and over again, why should we keep distance when we were vaccinated? Why can't I go to work when I'm not vaccinated, when, everyone else is vaccinated? All of those questions that you're getting, you need to really provide a quite clear guidance as to what the workplace is expecting and why, and also provide the medical information. If you don't have a medical advisor, I do recommend that you get an information from the Department of Health. Just so you know, the latest research is showing that unvaccinated people have 10 times more viral load than the vaccinated people, which means, if you're in a close contact with vaccinated person, you're less likely to actually have enough viral load to to catch the virus, and you're also vaccinated, and to catch the virus, but more importantly, to transmit to people at home that you love. But you still need to keep a distance, because there is still some viral load if you have been exposed to virus and you may be positive. So all of that information, it's important to be concise, clear, and updated regularly, so the people, and don't forget about that brain that needs to trust you. So the people need to trust you. If you don't have an information, say, I'll find out and let you know. Please don't. I had people just trying to come up with the excuses, and then that brain just doesn't want to trust you anymore, because you said it once and you changed it over and over again. So regarding the environment and equipment, it is very important to have a clear guidelines of what happens when they're going to meeting outside the work, people coming to meet at work, travels, flights, that raises anxiety. If I'm meeting with someone and that person starts coughing and sneezing, people are actually getting anxiety. What does that mean? Do I stop? Do they go, do I then have to test and isolate? Do they have to test and isolate, and so on? So you see how the way you manage COVID from the physical, what controls you have in place are very, very important for psychological well-being. So when you have controls for managing COVID appropriately, managing psychological part of that is really having a very good controls in place, and very good information training and communication, and very good escalation process. So who do I call? I don't need to really search on the internet, find out who do I call. I need to just have a phone and call, or know to where to report, what to do. So workload and work pace and work schedule, I'm not going to talk much about it. It has been talked a lot. There is lots of overtime work. There is lots of, especially now when people are working from home, there are lots of organizations that we observed actually had to make people redundant, but then found out that they still have lots of work. So we had lots of people that have been under lots of pressure. And I'm just going to highlight here for you guys, health, safety, and well-being representatives. We talk about doctors and health professionals being our heroes. I think in this next stage, you guys are going to be our heroes, and you are going to be a far front of your organization, making sure that the processes are there, the processes have been followed, the people understand, that people have been trained, that everything is working well. So you really need to look after yourself, and you need to really know who is going to help you, how you're going to actually control all of that. It's very important that you assess your own workload and what you're doing with it. I'm going to leave this. You're going to have this in your package. I think this is quite clear. I'm not going to talk about it. I'm just going to highlight a special consideration, acknowledge and appreciate workers' effort in coping with the change. From the psychosocial well-being, it's very important. Ensure leadership engagement and support, and create approach to managing workload in cases of a COVID positive case. So if someone is suddenly COVID positive and that person or that group suddenly has to isolate, you need to kind of have really clear, this is what happens, and it needs to be really smooth. So you need to work with leaders on understanding, if we need to send the whole group to testing, isolating, what's going to happen, what does it mean for a business. Violence and harassment, oh my God, where do I start? Especially here in Serbia, we have attacks every day on people. saying, please put a mask on, and they have about 9,000 cases a day. So we are going to have many cases, and we do in Victoria as well. And we've seen in Victoria harassment and violence in regards to this. So I think it is one of the most important factors that you need to include, especially if you're facing public, if you have a business facing public. So we've seen the violence in the healthcare worker, which workers in the sale and transport and essential goods. Cyberbullying has been really strong because people are working from home and they are on computers. Domestic violence and also what we've seen globally as well is stigma and discrimination. Not just people who had COVID, people just assume they haven't been vaccinated. There are lots of biases about who gets COVID, who doesn't get vaccinated, and who's not wearing masks. So I think it is very important that you do address that. I have some suggested actions here. I'll just highlight a few. And as I was talking about, established procedures to prohibit discrimination and assessment. Prohibit, I think it's a bit strong word. I should have changed that. But I think you need to really have a clear guidance of what is acceptable behavior at the workplace. You need to really normalize that, as I said at the beginning, every single communication that you're talking about, talking about the COVID, you need to educate leaders to start with normalizing that we all have different responses to COVID, we all have different beliefs. But when we are in a workplace, this is what is expected from you. This is how we function. And this is why, because we need to keep going, we need to work together, and, we need to perform. So if we were to do that, this is the agreement we have, this is how we behave at the workplace. So I think it is very important that you have those guidelines and that you then train your leaders how to, and you can actually model them and ensure that people are enforcing them. And provide workers with training on how to effectively diffuse hostile situations. I'm talking here about psychological resilience. I'm talking more about, that ability to step back and notice what you're doing, ability to be able to notice that the other person is coming from a different perspective, and also being able to have strength to speak up. And I would also encourage you to consider, if people haven't had any assertiveness training, to have some assertiveness training in addition to building psychological strength or psychological flexibility, whatever you want to call it. I need to have a strength and courage to step up and say something, but I also need to have skills to be able to say it in assertive, respectful, and caring manner. And we need to also provide social and psychological support. When we're talking about, so I'm moving to work-life balance, which is the fourth point. I'm just looking at the time. I'm going to share this. I'm just going to outline that there is a lot of research that has been done about work-life balance globally to understand whether it is better to stay at home and work, or is it positive or negative. So they do find out that working from home has a strong positive impact on work-life balance, and also work-life balance has a strong positive impact on job satisfaction. And also working from home has a negative or impact on work stress. So we are stressed less, and positive impact on work satisfaction. However, there are moderators or people or things that are actually enhancing this and impacting, and which we need to be aware of, and that is the family situation, e-leadership, so leaders' ability to actually engage and help and manage people online, and workload and pace. You know that. I'll just mention this. You really need to talk to your leaders and understand what their understanding of psychological support. I had some very senior leaders saying that they believe that they're doing a great job because they ask their staff at the beginning of every meeting to say one word to describe their emotions. And they thought they're doing a fantastic job. But when I spoke to their staff, they said, oh, we felt really intimidated, and we all found we're saying positive things because we didn't want to say anything that's considered negative. So really understanding and teaching your leaders of how, what does it mean to support your staff. I'm not going to talk about job security because I think you can read that. We're talking a lot about leadership, and I think it is a crucial point in this situation. The leadership capability for coaching and support is something that you really need to focus on and understanding where you sit there. That's a really important psychosocial risk that you're looking at. They also have a difficult and challenging time, so you really need to understand, where they sit and how does this impact your leaders. We were talking about communication, information, and training. We need to recognize this fake news and everything that's coming up from media and from other sources, as that will creep in the workplace. There will be disagreements and different opinions, and you really need to kind of look at. I've already spoke about this as to how you're going to address that, and how you're going to address these potential workplace conflicts. I will send you this, the communication and awareness raising suggested actions. I'm not going to talk about this. I believe I spoke about this before, but I'm going to send this to you. I'll talk more about training and development. I have this formula: empower, build, teach, train, educate, respect, which is all focused on, building a strong leadership, educating your employees, build flexible perspective taking in your workforce so that you can actually step back and engage with others, and train and educate and respect. It's quite clear there. I think I'll send you that as well. I'm trying to include as much information I can in this 1 hour, but I will send you. It's quite detailed. Now, the health promotion and building effective coping behaviors is something that I think it's important. We're talking about increase in alcohol consumption that we know it's happening in the COVID times, increase in smoking, poor sleeping, eating habits, in irregular sleep patterns is very important. So I would really encourage that you look at this part as well, and implement controls, educate, and also you can have lots of little reminders and health and well-being tips that you can help people, but understanding that people will come to work and will attend possibly from heavy drinking, not sleeping, or being in some other way affected. So you need to also review your alcohol and drug policies and have a look at what are the supports that you have in your workplace for that. And I think that the most important part, it's written in other slides, it is the education you provide to your managers about recognizing signs and symptoms of not coping, signs and symptoms of less cognitive functioning, and not just associate them with lack of performance. Just it's important the managers do understand that, lack of sleep will actually reflect on performance. So when they see suddenly decreased performance or engagement, that they actually start thinking about psychological aspects of it. Social support, I think it's also important. I'm not going to talk about it. It's written here. I'm going to actually move on to psychological support, where we are talking about what is the support that you can actually provide to your workforce. I think we are talking about anything that you probably already have, which is mental health first aid, maybe for your staff, which is looking at the context, looking at support around the person. We're talking about peer support, having people that people can talk to if they feel under pressure, but also, leaders, but also going down to actually individual, helping those individuals, if you haven't done so far, build those skills, coping, effective coping mechanisms, that they can recognize that they don't cope. They can recognize that they're actually, drinking more and more, and they can actually seek help for it. So promote help-seeking practices, and again and again and again, normalize it. The stigma around it, it's still high, so you really need to be able to normalize this and ensure that people are seeking help and it's easy to access it. Maintain confidentiality. The last point I want to raise is long COVID. The effect of it is we're seeing around the world already. The symptoms of fatigue, fogginess are lasting for more than 5 weeks and months. So you can expect that people will come to work, maybe even being cleared for work, but have all the weird symptoms, feeling cloudy in the head, or fatigued, or having a day on and day off. And so the psychological and cognitive impact and neurological of this virus is absolutely horrendous. And you need to not just understand and create a controls and support for that person, but also we'll think about how is that going to impact the work environment and people around that person. How is a team dynamic going to be affected by someone coming in and going out and coming in, the workload, all of those thoughts and feelings that are coming with someone being inconsistent and so on and so on. So you need to really, I was talking about it before, about having a process and procedure, but you really need to have also a very good return to work strategy. What does that mean? And so just to summarize it all, the most important parts that I would like you to leave this session with is that you need to agree on the acceptable behaviors, the most in this situation, have a absolutely fantastic communication, information and training program, provide a good communication strategy, a clear, concise and correct information, and absolutely up-to-date training program, clear guidelines, what needs to be done, who to report report to, when to report to. You need to work with your communication team on engagement and communication strategy. Engage all your parts of your business, engage your staff, work with them on communication, work with them, they need to adopt this as their own. They need to live it. If they are not engaged, they're not going to live this. And modeling and reinforcing desirable behaviors. You need to really be having leaders that are going to do that. So at last, I'm going to just say this is basically how you build your safety consciousness. We're talking about safety consciousness, the whole part about building, the communication strategy, building the psychological flexibility of your leaders and your staff is basically going from reactive safety measures, which is you tell people what they need to do, then you monitor whether you've done it, then you punish them when they haven't done it or something like that, to actually going to a commitment and prevention, a real prevention where people are going to commit to behaving in a safe way, commit to following guidelines, creating those guidelines with you because it's deeply meaningful to them, and they're going to actually engage in it and they're going to own it. So, when you're thinking about how you're going to build your safety strategy, I would encourage you to think about how you're going to build that commitment. We're talking about the difference between mindlessly following what I was told to do and maybe with really, reluctance to actually mindfully being engaged and doing it and noticing what I'm doing. And I want to do it because it's deeply meaningful and I'm committed to it. So that's, last one, don't forget your own well-being. So that's it.
Wow.
I'll send you these resources.
Thank you for that fabulous presentation, especially at what is now 3 a.m. in the morning where you are. So it was brilliant. I think we're all going to have to go and read your presentation when it does go up on the website, because there's just so much information there and some really useful tips and thoughts that we do actually need to introduce into our workplace. And I did love your line to say that us as OHS practitioners are the heroes. We hope that it does pan out that way as people do return to the workplace. So much food for thought. Hopefully we've got time just for a couple of questions. There's none in the chat box, but if anybody's got a burning question, even though it was a very comprehensive presentation, I'd invite you to turn on your mic and present to Dr. Natasha Lazareski now.
Lazareski.
Lazareski, I've been practicing.
Sorry. That's okay. I think I'm at the point where I'm going to change my surname. You're not the only one.
I just want to make a note that we have quite a few people here today who aren't financial members and won't have access to the slides. So if people would like to ask some questions about some of the slides that were skipped over, was there specific information you want to ask Natasha about, now is a good time to do that.
I'm so sorry. I thought everyone is going to have access to slide.
That's okay. So we can follow up by email if necessary.
Yeah.
Yes.
Sounding silence there.
Yeah, that's okay. Well, I might close it off now because it is getting to 1 o'clock, but people could stay on the line if they want to have a more informal chat. So thank you very much for joining us today. I just remind the people online that our next session will be on the 14th of December, and it's we won't have any guest speaker. We will all be speaking amongst ourselves. So each of you will be our guest speaker, basically. So we'll invite you to come back and join us for our December networking session. So thank you very much for coming, and we'll close off the recording now. And if anybody has a question offline, that's the time to ask. Thank you.